In urology, a Foley catheter is a flexible tube that passes through the urethra into the bladder to drain urine. It is the most common type of indwelling urinary catheter. The tube has two separated channels, or lumens, running down its length. One lumen, open at both ends, drains urine into the collection bag. The other has a valve on the outside end and connects to the balloon at the inside tip. The balloon is inflated with sterile water when it lies inside the bladder to stop it from slipping out. Foley catheters should be used only when indicated, as use increases the risk of catheter-associated urinary tract infections and other adverse effects. Foley catheters can come in several forms, such as a coude tip, which has a 45-degree bend at the tip that facilitates an easier passage through an enlarged prostate. A console tip catheter has a small hole at the tip, so it can be passed easily over a wire. And a three-way or triple lumen catheter has a third channel used to infuse sterile saline or another irrigating solution. These are used primarily after surgery on the bladder or prostate to wash away blood and blood clots. It's the physician's responsibility to prescribe the proper catheter to be used during insertion, depending on the client's condition. Urethras can come in different sizes, so it's important to use the proper Foley catheter for that particular person's body. The relative size of a Foley catheter is described using French units. The most common sizes are 10 French to 28 French. 1 French is equivalent to 0.33 millimeters of diameter. Foley catheters are usually color-coded by size with a solid colored band at the external end of the balloon inflation tube. This allows for easy identification of the size. And again, it is the physician's responsibility to prescribe the proper size of Foley to be inserted. Indwelling urinary catheters are most commonly used to assist people who cannot urinate on their own. Indications for using a catheter include providing relief when there is urinary retention, monitoring urine output for critically ill persons, and managing urination during surgery and providing end-of-life care. Foley catheters are used during the following situations: on patients who are anesthetized or sedated for surgery or other medical care, on comatose patients, on some incontinent patients, on patients whose prostate is enlarged to the point that urine flow from the bladder is cut off, on patients with acute urinary retention, on patients who are unable due to paralysis or physical injury to use either a standard toilet facility or a urinal, following any urethral surgeries, following a uterectomy, on patients with kidney disease whose urine output must be constantly and accurately measured, before and after a C-section, before and after a hysterectomy, on patients who have had any genital surgeries, on anorexic patients who are unable to use standard toilets due to physical weakness and whose urine output must be constantly measured, on patients with fibromyalgia who cannot control their bladder, and on patients who have severe skin impairment and/or breakdown from incontinent episodes. There are several risk factors when using a Foley catheter, including the balloon may break as the healthcare provider inserts the catheter. In this case, all balloon fragments must be removed. The balloon might not inflate after it is in place. That's why it's important to check the balloon inflation before inserting the catheter into the urethra. If the balloon still does not inflate after placement in the bladder, then it needs to be discarded and replaced. Urine stops flowing into the bag. The healthcare provider checks for correct positioning of the catheter in the bag, or for any obstruction of urine flow within the catheter tube. This can be alleviated from general flushing. Urine flow is blocked, then the Foley catheter must be discarded and replaced. The urethra can begin to bleed, and the healthcare provider monitors that bleeding. Catheterization induces an infection in the bladder. The risk of bladder or UTIs increases with the number of days the catheter is in place. If the balloon is opened before a Foley catheter is completely inserted in the bladder, bleeding, damage, and even rupture of the urethra can occur. In some individuals, long-term placement can have scarring and strictures of their urethra. Defective catheters may be supplied, which can break while in use. The most common fractures on a Foley include near the distal end or at the balloon. Catheters can be pulled out by patients while the balloon is still inflated, leading to major complications or even death. This may occur when patients are mentally impaired or are in a mentally altered state. For example, if they're coming out of surgery. If there are any complications or concerns while using a Foley catheter, always contact a healthcare professional for advice about what to do. We need to be sure that we are cleaning the genital area and the Foley catheter daily. Wash your hands with soap and water for at least 20 seconds. And then using mild soap and water, clean the genital area. And then remember that we may need to pull back their foreskin if needed. In women, we may need to separate the labia and clean the area from front to back. Clean the urethra, which is where the catheter is entering the body. Finally, clean the catheter from where it enters your body and then down the tube away from the body. Hold the catheter at the point that it enters the body so you don't put tension on it. Finally, rinse the area well and dry gently. We also need to follow these guidelines to prevent getting further infections while we have a catheter in place. Keep the drainage bag below the level of the bladder and off the floor at all times. Keep the catheter secured to their side to prevent from moving. Make sure that our clients aren't lying on the catheter or blocking the flow of urine in the tubing. Shower daily to keep the catheter clean. And always clean your hands before and after touching the catheter or the bag. As part of the daily maintenance of a Foley catheter, we need to be sure that the tube is open and the urine is able to drain freely into the drainage bag. The proper steps to take while irrigating a Foley catheter include using a sterile irrigant, such as normal saline or sterile water. Pour into a sterile container. Place the client in a semi-reclining position with a waterproof absorbent pad underneath the buttocks. And be sure to drape over the pubic area with a bed sheet to avoid any exposure. Put on clean gloves. Cleanse the junction of the catheter and drainage tube thoroughly for at least 30 seconds with an alcohol wipe. Carefully disconnect the tubing from the catheter. Holding the catheter upright, cap the drainage tube with a sterile protective sheath or clamp with your hands. Draw up approximately 30 to 50 mL of that sterile irrigant in a syringe and gently instill into the catheter. Remove the syringe and position the catheter over a drainage basin and allow draining by gravity, collecting the irrigation return in the basin. And be sure to note the appearance and the amount. Repeat this irrigation procedure until the debris is cleaned from the lumen of the catheter. If the fluid fails to return, stop the irrigation. An obstruction or an air pocket may be present. Try gently rotating the catheter or turn the patient from side to side to clear the catheter. Cleanse the end of the catheter and the end of the tubing with that alcohol wipe for 30 seconds. And then reconnect the catheter and the tubing to the drainage bag. And be sure to discard the return from irrigation into the toilet. The Foley catheter is held in place by the small balloon that's filled with water. So to remove the catheter, we must first drain the water from the balloon. This is done using a syringe and the balloon port. This is the opening in the catheter that isn't attached to the bag and allows you to get to the balloon. Instructions for removing the catheter include Emptying the bag of urine if needed. Washing your hands with soap and water, and be sure to dry them well. We need to gather the supplies, which would include a syringe, a wastebasket, a towel. Put the syringe into the balloon port on the catheter. The syringe fits tightly into the port with a firm push and a twist motion. Wait as the water from the balloon empties into the syringe. The force of the water will fill the syringe on its own. Depending on how large the balloon is, you may need to repeat this process several times until all of the water is out of the balloon. The marking on the balloon port will have the amount of cc's of water that is in the balloon, so we need to be sure that we have at least that amount in the syringe. Once the balloon is emptied, pull gently on the catheter. Put the used catheter in the wastebasket and throw away the syringe. Use the towel to wipe up any spilled water or urine if needed, and be sure to wash your hands again. If the catheter does not come out with gently pulling, stop and call the healthcare provider right away. Notify a healthcare professional right away if you notice a fever of 100.4 or higher, or as directed by your healthcare provider. If there's any questions at all about removing the catheter or any catheter care in general. The catheter doesn't come out with gentle pulling. There is no urination within 8 hours after removing the catheter. The belly is painful or bloated. There's a burning pain with urination that lasts for 24 hours. You see a lot of blood in the urine. Light bleeding is to be expected for 24 hours at least. Or else if there's complaints that the bladder feels like it's not emptying fully.